Brian Saville Allard, welcome to Mindworks and Conversation.
Yeah.
And really interested in hearing about your work in the patient simulation field and how you work your art into it or your art background and how that influenced perhaps how you even got into this field.
It's a long bit. I was born at a very young age. No, I mean, I've been working in the theater since middle school. I can't be, was heavily involved in theater in high school, and then was a theater major in college, theater education. Specifically, I've worked in theaters across the country and somewhat internationally in London, as well as teaching theater throughout that time. Settled in Portland about 20 years ago. Worked. I appeared on Grimm. I appeared on Leverage TV shows. I've done several films, including one called The Falls that did quite well. And then I started a Shakespeare company, the original Practice Shakespeare Festival in Portland, 17 years ago. And I've been working as the artistic director for that company since then, um, as well as performing with the company. And that company uses original practice techniques, so we don't rehearse, and we use scrolls and a prompter, which is how we believe that Shakespeare's company worked. But in addition to that, and especially as I got a little burnt out on teaching, found my way into simulation, started working as an SP quite a while ago, probably close to the 20-year mark, and then transitioned into being an SP trainer educator in 2019 at OHSU, Oregon Health and Science University.
How do you see theater arts fitting into patient simulation?
It's interesting because especially as trainers, when we're hiring and things like that, we do, the majority of the pool of people who interview for us are actors. Um, and we like having actors, but we also like having non-actors, uh, because I think it gives a diversity to the acting pool, to the performances. And a lot of times the people that interview feel anxious or concerned about the fact that like, oh, I don't have an acting background, and we're like, that is okay. We will teach you. Um, I think that my background as an improviser, which I didn't mention, I trained at the Brave New World workshop in Minneapolis, and I worked with um, in New York at Joe Franklin's Comedy Club for several years, and then with a company in Portland as well. I think that improv is a significantly useful skill for simulation. Um, the ability to create narrative quickly, because our cases, as you know, don't are more of a outline in a lot of ways for a person. I mean, there's definitely a narrative structure. There's definitely um, the specific things that you need to address, but when learners go off script, as it were, you have to quickly come up with responses and answers. So that's actually how I first got into being a trainer and educator, was that I was tapped while I was still in SP to teach some improv classes to the other SPs in our program. And actually, it wasn't until just a couple of years ago, after I'd been a trainer for a significant amount of time, that I discovered that there's actually a national simulation improv group, that the improv collaborative that I've medical improv collaborative that I've joined up with a bit. Since then, it was lovely to discover I wasn't the only person doing this, um, but specifically teaching improv skills in order to flesh out the characters and to give the SPs the ability that we call benign improv, to essentially create facts in the scenario, in the minute, in the moment, so that that are not medically um, problematic. You don't say that your parents had cancer when they ask you how they died, that sort of thing. Um, so that skill in particular has been really useful as something for us to tap into. And then also, I think that as I've used a lot of because I'm the scheduler for our program as well. So, in a way, there's the element of casting, which is something I do a lot professionally in theater that I'm able to use as well in this environment.
You mentioned that you're using both actors and non-actors, and really the job is about portraying a patient, acting as a patient.
hmm
What are the commonalities between those that do not describe themselves as actors and those that do? If there was a Venn diagram of behaviors or attributes, what would be in that center where there's the overlap?
I think the ability to play pretend. I mean, that's something that we're all born with. It just gets hammered out of a lot of us over time by society. Um, and obviously, actors are trained to do that in kind of a formal way. But in some ways, I think that working as an SP requires unlearning some of those um, not actor skills, but actor, I hesitate to say prejudices, but I don't have the word. But like actors sometimes have, I do it this way, uh, and and have to unlearn some of that to be an SP because this is not, you can't apply Stanislavski to simulation work. At least I hope you're not, because that could be very emotionally dangerous for you. So in some ways, those who come to the work without that baggage, uh, it's a little easier because what you need in the center of that Venn diagram, I think, is the willingness to play pretend, the willingness uh, to be creative, um, uh, preferably without those strictures that are already taught to us. World.
I don't know if you've ever heard this. Joff Norman from Canada, he was the one that came up with the term standardized patient. This is
Okay.
when it was still in development. And I think he wanted to I think that how he told the story, how I heard him tell it was he wanted to put an end to the argument about what should we call these people, program patients, simulated patients. And he said standardized patients, simulated patients in a standardized exam. So at a conference once, actually it was a meeting. He was where I worked at a national board at the time. I asked him, "What are standardized patients?" And he said, "Well, they are people that like to lie, take their clothes off, and get touched by strangers." So so when you said that we like to pretend, and that it's kind of a lost art that school does drive that out of us.
Mm,
And I never really thought of it until you just said that maybe the commonality is the desire to pretend to be something that you're not.
yeah. Or at least the willingness to.
The willingness to at least try to do that. Yeah.
I think that my personal philosophies of acting in our world, which are probably, I don't know if they're pertinent or not, but is that we get far too involved in trying to do psychological trickery with ourselves. It's just pretend, just get up there and be the part. I'm not interested in reading pages and pages of, what you've written about what the character had for breakfast. Like just it's illusion. It's creating the illusion of reality. And I mean that whether it's on a stage or in a simulation room. I'm I I get very I worry that we get so psychologically involved that we actually cause harm to actors. And I think too that in the acting world, acting is easy in a sense. It's playing pretend. It doesn't create, it's not a lot of labor. And I think that we feel guilty about that. So we create labor for ourselves in order to make ourselves feel like we're doing more work. I don't think
Yeah.
that, I think the month-long rehearsal process is ridiculous.
Well, yeah, certainly if you're doing this from the inside out, versus just learning your lines and
Mm,
pretending. It's really going to be hard when you're seeing student after student to turn that off in a dime. You have to turn in a dime and begin the assessment process and perhaps even debriefing after that. So yeah, I kind of warn actors against that, that this is not method acting.
No, and you're only able to practice one side of the story, right? Because like you don't know what your scene partner, if that's what you're calling the
Right.
learner, is, what they're going to bring to the table. So it's improv at most because like you've only got your side. You can't. We haven't rehearsed this scene. It's more like a we've prepared for it, and it's a sport. Like you get out there on the baseball field, you don't know what the other side's going to do. So here we don't know what that other learner's gonna what the learner's gonna say. So you can't be that prescriptive or else you're gonna break.
Do you ever have a chance to bring these improv skills or these acting skills to the med students as well? Because they're the ones also that have to be in the moment. You
hmm
can't be thinking through the next question when you're not listening to the answer that you just got.
I wish I had more of an opportunity for that. I know that the Medical Improv Collaborative does some work like that, but we just don't. Where I'm at, we don't have a program or funding or anything like that to put that in place. I think there's a lot of value in it. I think in the world, there's a lot of value to teaching improv skills to everybody. Myself, I'm neurodivergent, I'm autistic, and I didn't even know that until like 5 years ago. And in some ways, I credit my improv background and skills with the fact of being able to appear much more neurotypical to the world because I've been trained in how to deal with those scenarios, even if they aren't natural to me. And I think that anybody could benefit from that. Teachers, medical students, lawyers, all sorts of people.
Well, since you brought it up, is there any such thing as neurotypical?
Well, I would question whether that's true. Yeah, that's a good point. I would say that, I mean, I think there's definitely allistic, which is the not autistic, but I mean, is there typical or is there normal anywhere in the world? I mean, we put things on a chart maybe and say the things in the middle are normal or the things in the middle are typical, but I mean, ultimately everybody's an individual, and so I don't think I think that sometimes we do ourselves a disservice by trying to define the parameters of normal.
Yeah, I'm curious, how do you prepare the SPs to improv, to be in the moment? If you're not trained as an actor, and if that's a new exercise, and I know it could be scary, it's intimidating. It's intimidating for me. I'm not an actor, and I'm one that always wants to be prepared with the right answer, and it's really hard to do that.
Yeah.
How do you get the SPs to improv, to just listen to the question being asked and come up with an answer that's authentic and credible and seems realistic?
It's easier for some than others. We have dry runs and trainings and stuff, and my goal is that people have enough improv skills that they won't have to ask 1,000 questions in the training about like what if this scenario happens, what if this scenario happens, what if this scenario happens, sometimes to the sometimes to the comically unlikely. We have classes, and I start teaching. My first step is to try to teach them spontaneity. I usually use Keith Johnstone's activities from his book Impro, and I start with exercises and discussion about toward the idea of how we create spontaneity and the fact that we actually are born very spontaneous. When you watch children play, um, they're very spontaneous. They come up with things in the without thinking about it. But that we, as adults, as we grow, especially as we get into our adolescent years, and my son is 15, so I'm living this right now, um, start to lose that because we get the pressures from our peer pressure and our societal pressure uh, toward toward that normalness of and it's easier. The teens that don't lose it are usually the theater kids, right? Because they don't care as much what people think of them, at least in my experience when I was one. Um, and so, uh, but the biggest blocks to spontaneity being, a fear of seeming too out there, too wild, too crazy, too much. A fear of being boring. We have a fear of being boring, so we want to make sure that our choices that we make are all interesting and not just uh, saying the same thing over and over and over again in an improv moment. If somebody asks you your child's name in a scene or in an exam room, you don't want to just say Bob because you feel like that's too boring. Um, Apologies to all the Bobs out there. And and then the third one being a fear of being inappropriate or crossing uh, certain lines that shouldn't be crossed. So we have to keep kind of a guardrail on some of that, depending on what situation you're in. If you're doing an improv show at night, you can probably say a bunch of F words and that's okay. Probably not going to be okay in an exam room unless you're playing a specific type of character. Um, but we want the SP to let go of the idea that the thing the blocks to spontaneity of appearing boring or appearing too crazy, so that um, when they ask you what your children's names are, and that wasn't in the case, so you don't have something for that, and you don't just freeze or go through six different things in your head before you decide on one, which puts an unnatural pause and feels unnatural. Um, and the more we can build benign improv, the more we can keep from uh, having cognitive overload in our cases, because then we can put less faff. I don't know. I was going for two different words there. Um, Less padding into the case of things that you have to memorize. Then you don't have to memorize the names of your kids. You don't have to memorize the way that your parents died. You don't have to memorize all these things that are not actually important to the case, other than we don't want you to say the wrong thing. So we can start building that when we have the medical knowledge of what the wrong thing is. Cancer in a parent is going to lead them down a road that we don't want to go. And when we can let go of that hesitancy when it comes to simple facts that don't matter what the answer is, just so long as there is one.
Makes me wonder about the virtue of confusion. Education is so geared towards certainty, getting the
Hmm.
right answer.
Yeah, yeah.
And you see that with med students. I've seen thousands and thousands of SP encounters where, they can practice, they can make mistakes, but they're reluctant to do that. They're reluctant to be confused. And confusion is kind of the answer to getting the information. How would do you train people to be confused at all? That it's okay? Do you normalize the state of confusion as a learning opportunity?
Confusion for the. I'm just asking a clarifying question, although I think the answer is the same. Um, Confusion for the learner or for the SP,
I,
or
I guess
either.
both. Yeah. But yeah, what do you think? I'm a big proponent in the educational system of it's okay to be confused. In fact, if you're not, you're not doing your job.
I am very curious about that idea. I would say I haven't thought of it. Um, I would say that I'm a very big fan of making mistakes. Um, I mean, preferably not during surgery, but uh, in general, I'm a fan of making mistakes because that's how we learn, and of not shaming the mistake. It's something that we value in my Shakespeare company, and it's something that I think that we value amongst our SPs as well, which is when you make a mistake, own it and move forward. Like we as a society, we as human beings are so trained to be defensive and to protect ourselves when we make a mistake, to try to deny the mistake, to try to explain away the mistake. And I like to think that the better road is to be like, yes, I made that mistake, and I am going to learn from that and move forward. That is entirely what early formative simulation is about. Like we meet with our first and second year med students almost every week for them to do a simulation with the patient. And they're not going to be perfect. They shouldn't be perfect. If they're perfect, they should be moved on. They're going to make mistakes. Now, we want them to make mistakes in a safe way, which is part of what we're there for, so that they're not making those mistakes with real life patients. And we also teach our SPs a lot. We work with them a lot around their own personal safety and making sure that they are physically and emotionally safe, and that knowing that they can get up and leave the room if they're in an unsafe situation. And then we'll address that later of like, why did this happen? What was the mistake that was made? And how can we move forward together? It's always about safety and a safe place to fail, because we don't succeed until we fail, unless we're like a genius, I guess. I don't know. But even Einstein failed a lot, right? So I guess.
Just the final question I have
Hmm.
is about your style of teaching SPs to debrief the students.
Mm.
How do you do that?
That is honestly, that's probably the thing that we as trainers, educators, we use the term trainers at our school, but it's the same thing. Um, that we focus on probably more than anything is 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 debriefing, is feedback. And all of our like our standard Friday every week with the med students, they have 5 minutes of feedback with the learner before after each encounter. And what I believe and what we really focus on is the idea of getting the learner to debrief themselves. Is that I prefer that the SP take on the role of a coach rather than a teacher in that moment, of asking the learner what they experienced and getting them to tell you, and then working with them. Almost like I also tell them that it's like being a therapist, because you should be asking questions more than you're making statements of like, and how did that feel for you? Or tell me more about that. And type of, my wife is a therapist, so I get the language a lot. Um, and so that way we actually get, because you're going to get more engagement, more investment from the learner if they're the ones coming up with the ideas than if they have people like preaching to them all the time. That's what med school is. So they don't need us doing that too. It's better for us to get them to find those discoveries on their own. And that's using genuine curiosity. I'm not interested in like, I know the answer and I want you to get to that answer. I'm not interested in that. What I want is I want us to approach the learner with curiosity and openness, and um, be curious and not judgmental, as Ted Lasso would say. I want to approach that with, I really want to know who you are and what you experienced during this encounter, and we have 5 minutes to do that. So let's do it as quickly as possible. Um, some learners don't like that. Some learners are like, just tell me what I did wrong. But so then we have to teach them self-analysis.
Well, I think you're absolutely right. The point of debriefing is that they have to do it on their own. They have to ask themselves the questions. Why did I do this? Uh, maybe I should have tried something else. And so this idea of empathic curiosity is really key to learning,
I agree.
And I've always thought that the SPs are the ones that teach how to be curious by giving the students an experience of being listened to, of being empathic with the students. That, you just did something. I'm really curious why you did that. Can you and you do it with genuine curiosity. It's not with the finger pointing.
Yeah.
I'm really curious why you did that. And maybe they have a good answer. And but then after you
Don't.
hear, maybe then they need coaching, but it
Yeah.
doesn't. So people do like to go right from feedback to coaching, feed the student who have been fed forever. And so the point seems to be to get them to do the work. Let's talk about how you think.
Yeah, exactly.
Yeah. It's very much that maybe the way actors are trained. Why did you make that choice?
I hope they're trained that way.
Yeah.
My experience of acting was a lot of people training me what choices to make, but I,
Yeah.
I think it's changing. I think the culture is changing, which I think is good.
Yeah. Well, look, Brian, it was a really great pleasure talking with you, and I hope we can talk again, in particular about this issue of improvisation.
Hmm. Yeah.
I have some ideas I want to run by you and see
Oh,
if you're
wonderful.
and see if you're interested. So, Thanks for doing this. I really appreciate your time.
Yeah, of course. Happy to help.